Hello ladies and gentlemen, today we're going to talk about the circulatory system, which is composed of four different components. You have the brain, which usually regulates the three other components and tells them what to do. You have the blood that delivers oxygen and nutrients throughout the body, also picks up and removes waste like carbon dioxide. It can transfer heat to different parts of the body using the vascular system. The vascular system is comprised of arteries, veins, and capillary. And then you have the heart. So there's two aspects when we're talking about the movement of blood. Vasoconstricts, where the blood moves towards the heart, and usually when we're trying to tell whether the body is vasoconstricting, it'll be pale, cool, or clammy in terms of the extremities, which are the hands, the arms, the feet, or the foot. And then you have vasodilates, where the blood pushes away from the core area. And usually the body is red, hot, or flush. Or the extremities is usually red, hot, or flush. The brain has four basic needs. It needs sugar, which is in the form of glucose, temperature, which is usually around 98.6 degrees Fahrenheit, oxygen, also known as O2, and then pressure. So some of the things in terms of things that might happen to the body when you're in the wilderness first aid setting is low oxygen to the brain. This can be due to haze. It can be due maybe to obstruction in the airway and things like that. So how the body tries to provide more oxygen is it vasoconstricts. The blood moves towards the heart into the lung area, and so that way it will increase the heart rate and increase the breathing. And that's how the body will compensate in order to get more oxygen to the brain. So there's two main things that usually happen in an outdoor setting in terms of incidences. And one is hypothermia, where the body is getting very, very cold. So what do you think the blood is doing? Is the blood being pushed from the core to the extremities? Or do you think the blood is going from the extremities to the core? You're correct. The body is vasoconstrict. So the blood is moving towards the heart, towards the core area. So that way it only has to heat up the core area to 98.6, and it's not really worrying about the extremities. So the extremities might be pale, cool, or clammy if somebody is having hypothermia. Another incident that we usually see is heat stroke. So with heat stroke, is the body pushing the blood to the extremities, or is it trying to push the blood towards the core area? Correct. The body is vasodilate, where the blood pushes away from the heart, because the core area is so hot that it's trying to sort of dilute the blood, and so it's pushing it anywhere it can away from the core area, and the furthest part it can send the blood is to the extremities. So what we usually see when someone has heat stroke is, especially on the feet and on the hands, red, hot, and flush.